a group called the elders, which I guess makes the decisions, which means I shouldn't know anything that's going on. There are a few children, and there are a few, like Elsie, who takes care of the children.
And what do you remember after you go back to yourself? Do you remember anything?
No.
So it's just a blank?
It's a blank. I remember nothing.
It's quite
I don't even realize sometimes that I have switched.
That's quite frightening, isn't it?
Yes, it is. Yes, it is.
Don Condy has been treating Louise for 14 years and has no doubt her condition is genuine. He says that, like almost all patients with the rare disorder, it came on as a result of traumatic childhood experiences.
When she was a child, because of the horrible abuse that she was suffering, there was no escape except by doing some sort of escape into another part of her own mind and letting another personality come out and take the punishment that her mother might be doling out to her. As she's gotten older, that pattern has stayed around.
When under stress, Louise says she can still lose hours or even entire days as her other personalities take over to protect her from difficult situations. Despite the experience of patients like Louise, the condition remains controversial. Some feel that the other personalities have been invented by the patient or even by the psychiatrist. This scepticism is partly due to a number of high-profile cases which have cast doubt on the very existence of the condition.
This one I killed.
One of the most famous occurred 20 years ago when the murderer, Ken Bianchi, used multiple personality as a defence, claiming his alter ego, Steve, carried out the killings. Eventually, he was proved to be faking it.
Hi, how are you?
Hi.
With Dr. Condy's help, Louise has recently developed an unusual skill. Unlike most multiple personality patients, she can apparently make a switch on demand.
All right, well, what I'll do is just count from 1 to 5. All right.
Dr. Condy says he isn't using hypnosis, simply a technique to help Louise focus.
3, 4, 5.
Oh, bonjour, médecin. Comment ça va?
This is Elsie, a French-speaking character.
Bon, I'm good. Oui. I've been watching.
Later, she becomes a child called Watcher.
I've been watching.
You saw some scary stuff, huh?
This ability to switch at will makes Louise an ideal subject for research.
Yeah.
In the last few years, MRI scanners like this have given scientists unprecedented access to the brain, allowing them to see brain activity actually taking place. The question is, can it shed some light on the mystery of multiple personality disorder? It's something a colleague of Dr. Condy's, Goshen Sai, has wanted to try for some time.
There are two problems to do this study. Number one, in the past, we don't have a machine like fMRI who can do the study quickly and correctly. Number two, we don't have the right subject, which can kind of control their switching, because we need to have them to switch on the scanner.
Hi, Louise. My name is Susan. I'm going to be doing your scan.
The doctors show us how they scan Louise's brain. Because she can bring on her switching, they'll ask her to change character while the machine is on. She won't be able to move or speak during the test, so she's asked to activate a warning beeper to indicate when she's switched.
Okay. I want you to practice with that. Squeeze that ball.
Louise is first asked to switch to one of her childlike personalities.
Okay, now I want you to switch to Watcher now. Imagine that you're an 8-year-old girl named Watcher. You like to watch what happens with Louise.
The switch happens, and then they do a control experiment. Louise is asked not to switch, but to pretend to be an imaginary child.
I want you to imagine you're an 8-year-old girl named Player. You like to play with a neighbor girl named Helen.
The results of the original test on Louise appear to show something remarkable. These coloured areas represent a big decrease in brain activity at the very moment Louise switches personality. Intriguingly, it happens in the hippocampus, an area responsible for long-term memory. But there's no change during the control experiment.
So you can see here, that's a brain structure called hippocampus. That's the area where activity got changed, as highlighted by color here, when she switched personality.
So what do you make of these results?
To me, that is saying that there's a brain basis for her personality switching.
For Louise, the results are great news.
I was ecstatic over the results because there was finally proof, a way to prove for all those people out there who don't believe that it exists. There was finally proof that it does.
Louise is now happily settled with her new husband, Cliff, and hopes before long she'll stop switching personality. The psychiatrist would like to do more tests on her and find other similar patients to see if the results are more than a one-off. If so, it's hoped the work may one day lead to a definitive test for the condition and even new treatments.
Well, Louise certainly feels vindicated by the results of the scan, but the researchers in Boston think there's still a lot more work to do. And as it's such a controversial condition, we have with us Dr. Raj Prasad and Dr. Tonmoy Sharma. Now, Dr. Prasad, you are convinced that the condition exists.
Well, like most British psychiatrists, before this new study came along, I was pretty sceptical about whether multiple personality disorder really existed. And that was partly because here in Britain we make the diagnosis much less frequently than they do in America. And in Britain we often believe that maybe these people are pretending to have other personalities as a way of getting attention. But the important thing about this new study and why it's very persuasive is that while this lady was in the brain scanner, they asked her to pretend to be another personality. And the brain activity changed and was different to when she actually was behaving as if she had another one of her alternative personalities. And this is very persuasive evidence that multiple personality disorder isn't just pretense and really exists.
Very persuasive if you believe in the evidence of the imaging. Dr. Sharma, you're an expert in the imaging and you remain unconvinced.
Well, in an imaging experiment, you have to have two conditions that are equal. So in this case, the problem is that the two conditions do not have equivalent emotional importance to this person, because the pretend condition is a neutral condition. And we know that there is activity in those parts of the brain, in the hippocampus that was shown in this paper, in emotionally laden conditions. So I think the jury is still out, though this is an important first step.
What you are both in agreement about is that we do need hard evidence for the existence of this condition in patients. Why is that?
Well, we do because in many situations, like in a criminal trial, some people claim to have multiple personality disorder as a way of getting out of taking responsibility for their actions. And this kind of new technology will finally be able to tell us when people really have a disorder or are just pretending.
Thank you both very much.